Welcome to Healify Hub, your trusted source for senior health awareness. Right now, millions of older adults are taking medications that could be silently destroying their hearts. And here's the shocking part, these aren't illegal substances or experimental treatments. These are common drugs sitting in medicine cabinets across the world. Drugs that doctors prescribe every single day. A growing number of cardiac surgeons and cardiologists are now sounding the alarm. They're seeing patterns in their operating rooms that they can't ignore. Hearts that should be relatively healthy for a patient's age are showing damage that seems almost impossible. Inflammation markers are through the roof, heart muscle is weakened, and rhythm problems are appearing out of nowhere. When they trace back the medical histories, they keep finding the same culprits over and over again. The research is finally catching up to what these surgeons have been witnessing firsthand. Major studies from institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology are now confirming what many suspected. Certain medications that millions of older adults take regularly are causing measurable, documented heart damage. We're not talking about rare side effects that happen to 1 in a million people. We're talking about significant cardiovascular risks that affect substantial percentages of users. Some of these drugs increase heart attack risk by over 40%. Others double or even triple the chances of developing dangerous heart rhythms. And the most alarming part is that many patients have no idea they're at risk. But there's one drug on this list that stands above all the others. One medication that cardiac surgeons are now calling the silent heart killer. The research on this particular drug is so alarming that some experts believe it should carry a black box warning, specifically for older adults. A massive study involving over 500,000 patients found that this drug was associated with catastrophic cardiac outcomes. And the worst part is, alternatives exist that are far safer. But before we reveal that number 1 drug, let me walk you through the complete list so you understand the full picture of what could be damaging your heart right now. Before we begin, let us know in the comments your age and where you're watching from. We read and reply to every single comment, so drop them below. Now, without any further ado, let's get started. Number 7. Proton pump inhibitors. You probably know these drugs by brand names like Prilosec, Nexium, and Prevacid. Proton pump inhibitors, commonly called PPIs, are among the most prescribed medications on the planet. They work by reducing stomach acid production, which helps with acid reflux, heartburn, and ulcers. For years, they were considered incredibly safe. However, recent large-scale studies have painted a much darker picture. Research published in the British Medical Journal found that long-term use of PPIs is linked to a significant increase in the risk of heart attacks. Another study from Stanford University found a connection between PPIs and a higher risk of heart failure and kidney disease. The theory is that these drugs might reduce the production of nitric oxide in your blood vessels. Nitric oxide is crucial for keeping your arteries relaxed and flexible. Without enough of it, your blood vessels can constrict, raising blood pressure and forcing your heart to work much harder. This increased workload over time can lead to serious heart damage. Remember to never stop taking a prescribed medication without first talking to your doctor. They can help you weigh the risks and benefits and explore safer alternatives if needed. For short-term use, they can be incredibly helpful. The problem is that millions of older adults have been taking them for years, or even decades, and the heart-related consequences are now becoming impossible to ignore. A landmark study published in the journal PLOS ONE examined data from nearly 3 million patients. The researchers found that people using PPIs had a 16 to 21% increased risk of heart attack compared to non-users. Now that number might not sound dramatic at first, but when you consider how many people take these drugs daily, we're talking about hundreds of thousands of additional heart attacks that could potentially be linked to PPI use. The mechanism behind this damage is fascinating and terrifying at the same time. PPIs appear to reduce the production of nitric oxide in the cells that line your blood vessels. Nitric oxide is absolutely critical for cardiovascular health. It keeps your blood vessels relaxed and flexible, prevents blood clots from forming, and protects against inflammation. When nitric oxide levels drop, your arteries become stiffer, blood pressure rises, and the risk of dangerous clots increases dramatically. Another study from Stanford University found that PPIs were associated with a doubled risk of cardiovascular mortality in patients with coronary artery disease. The researchers were so concerned by their findings that they recommended physicians reconsider long-term PPI prescriptions, especially for older adults with existing heart conditions. The good news is that many people can manage their acid reflux with lifestyle changes and safer alternatives. Losing excess weight often dramatically reduces symptoms. Eating smaller meals and avoiding food within 3 hours of bedtime helps enormously. Elevating the head of your bed by 6 inches uses gravity to keep acid where it belongs. For those who still need medication, H2 blockers like famotidine appear to be much safer for the heart while still providing meaningful acid reduction. But this is just the beginning of our list, and the cardiac risks get significantly more serious from here. Number 6. Certain antibiotics. This one catches most people completely off guard. Antibiotics save lives. They're one of the greatest medical discoveries in human history. But certain classes of antibiotics have now been conclusively linked to serious heart problems in older adults. The biggest offenders are fluoroquinolones, which include drugs like ciprofloxacin, levofloxacin, and moxifloxacin. You might know these by brand names like Cipro, Levaquin, and Avelox. Did you know some common medications could be silently harming your heart? Let's talk about fluoroquinolone antibiotics. These are drugs like ciprofloxacin and levofloxacin. A massive study in the Journal of the American College of Cardiology looked at over 7 million patients. It found that using these antibiotics was linked to a 66% higher risk of aortic aneurysm or dissection. That's a dangerous bulge or tear in the main artery of your body, which can be fatal. This risk seems to last for about 60 days after you stop taking the drug. But that's not all. These antibiotics can also cause something called QT prolongation, which messes with your heart's electrical rhythm and can lead to dangerous, irregular heartbeats. The FDA has actually warned that these powerful antibiotics should be reserved for serious infections where no safer options exist. For common things like a simple UTI or sinus infection, older and safer antibiotics like amoxicillin are often just as effective without the same heart risks. So if your doctor prescribes a fluoroquinolone, it's always smart to ask if there's a safer alternative for your specific situation. Next up, a medication millions use for pain relief, NSAIDs, or non-steroidal anti-inflammatory drugs. You know them by brand names like Advil, Motrin, Alebi, and Celebrex. They're great for pain and inflammation, and for younger people using them once in a while, the risk is low. But for older adults or anyone taking them regularly for chronic pain like arthritis, the story changes. A huge analysis in The Lancet looked at data from over 350,000 patients and found that high-dose SAIDs increased the risk of major cardiovascular events by about 1/3. The drug celecoxib, sold as Celebrex, was shown to increase heart attack risk by 37%. While these drugs are effective, it's crucial to be aware of the potential heart risks, especially with long-term use. Did you know some common over-the-counter pain relievers could be silently harming your heart? Let's talk about non-steroidal anti-inflammatory drugs, or NSAIDs. A huge study revealed some shocking numbers. For ibuprofen, the risk of a major cardiovascular event went up by 44%. And for diclofenac, widely used outside the US, the risk jumped by a staggering 41%. So how does this happen? Well, NSAIDs block enzymes that produce substances called prostaglandins. Some of these prostaglandins are actually there to protect your heart and blood vessels. When you block them, you tip the scales towards more blood clotting, higher blood pressure, and increased inflammation in your arteries. NSAIDs also make your body hold onto sodium in fluid, which further raises your blood pressure and strains your heart. A massive study from Denmark followed over 1 million people and found that even short-term, SAIDs increased cardiovascular risk starting within the very first week. This completely changed the old belief that a short course was always safe. For older adults with chronic pain, it's really important to look at alternatives. Acetaminophen, like Tylenol, doesn't have these same heart risks, but you do need to be mindful of its effects on the liver. Topical NSAIDs, which you apply directly to the skin, are a much safer option for the heart because less of the drug gets into your system. And don't forget physical therapy, managing your weight, and specific exercises. These can often reduce the need for pain meds altogether. Next up is a medication that many cardiac surgeons are particularly concerned about, especially since so many older adults rely on it. Number 4 on our list, certain diabetes medications. Having diabetes already significantly increases your risk of heart disease, so the medication you take for it is critically important for your heart's health. Not all diabetes drugs are the same. While some newer ones actually protect the heart, some older, widely prescribed drugs have been linked to an increased cardiac risk. The sulfonylurea class of medications, including drugs like glyburide, glipizide, and glimepiride, has been under the microscope for years. They work by making the pancreas release more insulin. One major study that followed over 250,000 diabetic patients found that using sulfonylureas was linked to a 20% higher risk of cardiovascular death compared to using metformin alone. Another study found that glyburide, in particular, was associated with a much higher risk of heart attacks. The problem is multifaceted. These drugs can cause low blood sugar, which releases stress hormones that are tough on the heart. They might also affect the heart muscle cells directly, making them more prone to dangerous rhythms. Some researchers even think they could speed up the buildup of plaque in your arteries. The difference between these and newer diabetes medications is just striking. Today, we're diving into a crucial topic that affects millions of older adults. Medications that could be silently harming your heart. Let's get right into it. First, let's talk about some older diabetes medications. If you're an older adult taking a sulfonylurea for diabetes, this is definitely something to discuss with your doctor. Why? Because newer medications have shown incredible benefits beyond just lowering blood sugar. SGLT2 inhibitors like empagliflozin and dapagliflozin have been proven in large clinical trials to actually reduce the risk of heart failure and cardiovascular death. Similarly, GLP-1 receptor agonists like semaglutide and liraglutide also show significant cardiovascular benefits. Remember, the goal of diabetes treatment isn't just to get good numbers on a lab test. It's to prevent deadly complications like heart disease. Next on our list are certain sleep medications. Sleep problems are incredibly common in older adults, with nearly half of people over 65 reporting difficulty sleeping. So reaching for a sleeping pill is completely understandable. However, certain ones have been linked to serious heart risks. Z-drugs like zolpidem, which you might know as Ambien, are among the most prescribed. A huge study found that these hypnotic sleep aids were associated with a 4.5 times greater risk of death, with cardiovascular events being the leading cause. How does this happen? Well, these drugs can suppress your breathing, which worsens sleep apnea. And sleep apnea is a major risk factor for heart disease, high blood pressure, and stroke. They also increase the risk of falls, and the stress of a fall-related injury can trigger a heart attack. Benzodiazepines like lorazepam carry similar concerns. The good news is better approaches exist. Cognitive behavioral therapy for insomnia, or CBTI, is proven to be more effective long-term than pills. Simple things like keeping a consistent sleep schedule and avoiding screens before bed also make a huge difference. If you still need help, low-dose melatonin appears to be a much safer option. Now for number 2, and this might surprise you, certain antipsychotic medications. These are sometimes prescribed to older adults for agitation or behavioral issues related to dementia. Their use has grown, and so have the cardiac concerns. A landmark study in the New England Journal of Medicine found that elderly patients taking these drugs had roughly double the risk of death compared to non-users, primarily from sudden cardiac events. The risk is so significant that it is crucial to explore all other options first and use these medications only when absolutely necessary at the lowest possible dose. Antipsychotic medications. Whether they're older ones like haloperidol or newer ones like risperidone, olanzapine, and quetiapine, all come with increased heart risks. These drugs can dangerously alter your heart rhythm and cause metabolic issues like weight gain, high blood sugar, and bad cholesterol levels, all of which raise your risk for heart disease. Some also block certain receptors that can cause a sudden drop in blood pressure when you stand up, a condition called orthostatic hypotension. This can lead to falls, fainting, and sometimes sudden cardiac events. The FDA has even issued black box warnings about using these drugs in elderly patients with dementia-related psychosis, noting a higher risk of death. Yet, their off-label use in care settings is still shockingly common. There are safer ways to manage agitation in older adults. Often, simply treating underlying issues like pain or infection can solve the problem. Adjusting the environment by reducing noise or keeping a consistent routine can also make a huge difference. If medication is absolutely necessary, the key is to start with the lowest dose for the shortest time. Now let's reveal the number 1 drug on our list, the one that cardiac surgeons consider the biggest threat to the hearts of older adults. It's certain prescription pain medications. That's right, opioids like oxycodone, hydrocodone, morphine, fentanyl, and tramadol. You might know them by brand names like OxyContin, Vicodin or Percocet. While they're incredibly effective for severe pain, their impact on the cardiovascular system of older adults is undeniable. A massive study in the Journal of the American Heart Association looked at over 500,000 patients over 65. It found that long-term opioid use was linked to a staggering 65% increased risk of cardiovascular death. Another study found that starting opioids more than doubled the risk of cardiovascular events within the first 30 days. How do they cause this damage? Opioids slow your breathing, which means less oxygen in your blood, putting immense stress on the heart. During sleep, this can become dangerously low, triggering inflammation that damages blood vessels and heart muscle. Chronic opioid use can even cause structural changes to the heart that mimic heart failure. They also disrupt the nervous system that controls heart rate and blood pressure, making the heart less resilient to stress. Studies show opioid users have reduced heart rate variability, a key marker of heart health that, when low, is linked to a higher risk of sudden cardiac death. Opioids add another layer of cardiac risk, especially for older adults. How? Well, these drugs can suppress your immune system in ways that actually encourage the development of atherosclerosis, which is the hardening of your arteries. Research shows that people who use opioids often have higher levels of inflammatory markers linked to heart disease. They also seem to experience a faster buildup of plaque in their arteries compared to non-users. What's really concerning is how opioids interact with other common medications. For instance, combining opioids with benzodiazepines is a dangerous mix. Both drugs slow down your breathing, and when you take them together, that effect is dangerously amplified. If you're on heart rhythm medications, opioids can worsen a condition called QT prolongation. And if you take them with blood pressure medication, you risk a dangerous drop in blood pressure. So, what's the path forward for older adults dealing with chronic pain? It's challenging, but absolutely possible. Pain management specialists now recommend what's called a multimodal approach. This means combining several non-opioid strategies. Physical therapy can address the root mechanical problems causing the pain. Procedures like nerve blocks can offer targeted relief without the side effects of systemic drugs. And cognitive therapies can help you develop skills to manage pain without constantly relying on medication. For those already taking opioids, it's often possible to gradually reduce the dose under a doctor's care. Many people find their pain actually gets better as they lower their opioid intake. This might sound strange, but over time, these drugs can make you more sensitive to pain through a process called opioid-induced hyperalgesia. The experts sounding this alarm aren't telling you to just throw away your pills. They're urging you to have an informed conversation with your doctor about the cardiac risks. Many medications that seemed perfectly fine when they were first prescribed now have known heart risks that we did and fully understand back then. The research has evolved and our understanding has deepened. You deserve to know what this new research shows so you can make the best decisions for your health and your heart. The heart damage from these medications is often preventable, but prevention starts with awareness. It requires a conversation and a willingness to explore safer alternatives. Here's something I'm curious about. After hearing this, are you thinking about talking to your doctor about your current medications? Or do you worry that bringing up these concerns might strain your relationship with your healthcare provider? I really want to know what might be holding you back or pushing you forward, because this conversation is more important than many people realize. We want to hear from you. Are you or someone you know taking any of these medications? Have you noticed any unexpected heart symptoms since you started them? Share your experiences and thoughts in the comments below. We love hearing from you. Thanks for watching, and for more doctor-backed health insights for seniors, subscribe to our channel.